Good afternoon, everyone. We're delighted that you're with us, and we're going to begin our webinar. My name is Steve Love. I'm President and CEO of the Dallas-Fort Worth Hospital Council, and we really appreciate you being here today. And this is going to be a very educational webinar, and it's hosted in coordination with SureCost, an associate member of the Hospital Council. Today's topic: 2025 pharmacy trends, controlling cost, driving compliance, and reducing workforce burnout. And for those of you in the industry, what a great topic currently with what's going on. It's a challenging landscape. Hospital pharmacies are constantly having to adapt to new challenges. Today, we're going to speak with two national experts. They're going to discuss the top issues in pharmacy, including rising drug prices, revamped procurement, compliance challenges, staff burnout, drug shortages, and how we can improve purchasing and our materials processing management. Our speakers today are Chad O'Connor. He's Vice President and General Manager of Acute at SureCare, and Calvin Hunsicker, Founder and Chief Product Officer at SureCare. And we're delighted that both of them could be with us today. What a great topic. We're looking forward to the presentation. One administrative item before we begin: we will be taking your questions. If you just please enter them in the question box or the chat box, then at the end of the presentation, we'll try to answer those questions for you. With that, ladies and gentlemen, I give you Chad O'Connor.
Thanks, Steve. Appreciate that warm welcome. Hello, everybody. We are delighted to be here today. As Steve kind of set up, we've got a lot to talk about. Pharmacy is obviously a critical area to every health system and U.S. healthcare in general. There's some trends that we're going to walk through, as Steve highlighted. Some of these aren't, or most of these aren't actually that new, but it feels like they all have a new wrinkle over the last year at the most, and sometimes last few days. So yeah, drug prices continue to skyrocket. Getting the product we need to care for patients seems to get harder every day. And then on top of that, the burden on the pharmacy work staff is a lot like the burden on our other clinical staff, nursing, physicians, and the rest, where we see high rates of burnout, turnover, and replacing folks when we lose them is very, very difficult. Also important, the financial impact that the pharmacy can play both on the cost side, but also as a revenue generating area continues to evolve. So we'll talk through a little bit about that today as well. The other part that's kind of interesting when discussing the pharmacy is the different parts of the system of care that the pharmacy interacts with. So, of course, we're going to be talking about the inpatient setting and how we care for patients and within the hospital, but increasingly retail, outpatient infusion centers, long-term care, and other places that the pharmacy enterprise exists will also be part of our talking points. Many of these trends will play out similarly across different classes of trade, but some will be impacted much more than others, and we'll talk about that. So with that, we'll start with rising drug prices. Again, not a new issue. Over the last few years, some well-known or documented reasons for rising prices, such as inflation, inability to get the product that you need to build the final compound. Then we see areas like oncology and neurosciences and the role of biosimilars causing kind of explosive growth in cost. And then on top of all of that, again, we've seen transient issues such as factories shutting down or manufacturer bankruptcy, all of a sudden reducing the number of places that we can get product. But one that has emerged a little bit over the last year or so and continues to be relevant is the Inflation Reduction Act. So maybe, Calvin, you could talk us into a little bit about how that plays into rising drug costs and where you see things playing out over the next couple of years.
Sure. Yeah. Thanks, Chad. So yeah, I guess a couple things. One, just to give a little bit of landscape here in terms of historics. Generic drug prices as a whole have actually decreased. There's been deflation essentially in the generic market. And that has actually slowed the last couple of years, like say this year, last year, they've seen that kind of stabilize. It is still, lower over preceding year, but it's actually kind of not decreasing at the rate that it was, in prior years. And part of that is, part of the reason for deflation in generics is really because of the fact that there were a lot of vendors in, a lot of these like blockbuster drugs went generic, so a lot of competition in that market space. Because now folks are getting out of those markets, there's fewer vendors, we're starting to see prices stabilize and even in some cases go up. Brands, we used to see double-digit inflationary numbers on brand product. That has kind of gone down to upper single-digit numbers over the last several years, say 4 or 5 years. One of the bigger drivers really of higher cost drugs is really on the biologic side. Those products, are now 40-50% of dispenses in terms of dollar wise. And so that has really inflated costs. And so the Inflation Reduction Act was really to handle kind of two things. One is to ensure that branded product is not increasing, significantly. And if it is, then they have to pay Medicare back, the delta of that. The other is for these bigger drugs that are very, very expensive. When I've been in pharmacy my whole life. And I was in pharmacy, the cost of a medication, for a patient, even like a full bottle of a medication, is somewhere in the $30-$40 range. We're talking, drugs now costing, $10, $15, $20, $25,000. And so, the cost of carrying a drug for a pharmacy and the cost to a potentially patient is significantly higher and obviously outstripped inflation and really pretty much every area. And so the Inflation Reduction Act was started in 2022 with the purpose of trying to control some of those prices. And it's really a vehicle for Medicare to help, negotiate prices directly with the manufacturer. So they start with 10 agents. Those 10 drugs they'll actually negotiate with those vendors, with the manufacturers, and they'll get rebates back to it. And then they're also setting a cap on the price. The first instances was insulin. So insulin was one of those drugs that actually happened last year in January, where that was reduced about a third in terms of what it used to cost patients and ultimately even what it costs pharmacy. However, one of the things that everyone's kind of discovering with this program is that the cost of the pharmacy is still over what the Medicare is actually paying. And so it's becoming prohibitive in terms of, margin wise. And again, this maybe not impacting acute, but it's certainly, as drugs are being prescribed in the acute setting for a patient that now is going to outpatient setting and it would be under Medicare is at a point where it's actually not even profitable. And when I say not profitable, give you an instance, like for insulin, the maximum fair price that Medicare set was $35. So that's what they're willing to pay for insulin. However, the average price to invoice price to pharmacies around in the low 40s. So, they can't lose $5, $6, $7, $8 on a script every time they dispense it. We have carrying costs, dispensing costs, and all those things that go into it. So long story short, there is some pain that comes out of this program. There was some hope that with the new administration, there'd be some changes that would actually, maybe not change the way this is being handled. However, President Trump did sign on Monday to actually continue with the Inflation Reduction Act and actually added more teeth to it. He wants to actually include biosimilars. There's a waiting period for both brand and biosimilars to be on the program. They want to reduce the time for biosimilars. They also want to add transparency around PBMs, which again, that's a good thing. I think there needs to be more awareness on PBMs and what they're getting for the public. And they're also trying to promote drugs being imported from Canada. Florida was one of the first states to actually enroll in that. The FDA approved it. This was back in January of last year. However, there has been no active, nothing that's actually happened as of yet. And with the tariffs, that may be a moot point because the tariffs might offset any savings that potentially would come from that. So I will quote Mark Cuban. Actually, there was an article that I guess he was speaking on a podcast. It was Somebody's Gotta Win with Tara Palmera, and he was saying that if we have high tariffs on drugs coming from India, we won't have a choice but to pass it on to consumers. So I mean, there's pressures both in terms of the tariff aspect as well as the Inflation Reduction Act here that's being implemented. And if you want to switch to the next slide, Chad. These are the drugs that actually, are phase one. So there were 10 drugs that were selected for phase one. Medicare has already negotiated those. These go into effect for January of 2026. So these would be the first drugs, Eliquis and Xarelto and so on. Very, very big names, and what they've done is they focused on some of these higher cost products that really impact Medicare and, and being able to cap those. And like I said, have Medicare have the ability to actually negotiate on behalf on behalf of themselves for those drugs. And so the rollout of this is 10 drugs for starting 2026, and then there's 15 drugs that will be selected for 2027, and then another 15 for 2028. Now, we don't know if that's going to accelerate or stay the same as what has been, proposed from the past. From everything that's been talked about, at least up until today, it appears as though that's still holding true, that it's going to be these 10 and then 15 and then another 15 the following year. So again, if you're involved in, with your Congress folks, if this is something that's going to impact you in a negative way, I do, encourage folks to actually, speak to your Congress people to kind of create more awareness of how these programs really potentially do not reduce the cost of drugs, at least in terms of, from a practicality to patients. Yes, they do reduce from Medicare standpoint, but we all know that if this is actually being done in Medicare, other PBMs, other payers, Medicaid and so on will follow suit, to essentially do the same thing. And there has to be a balance between, fair pricing and ultimately being able to be paid a fair price in dispensing those products. But so that is something that's happening, on the Inflation Reduction Act, and just kind of wanted to cover that topic. That is one of the challenges for pharmacy. Again, indirectly impacts acute, but is something to be aware of.
Yeah, and I think an important part of this conversation is what can we also do about it. For those that haven't interacted with SureCost before, we work with over 1,600 pharmacies in the U.S. and we're hearing a range of things that can be done, and I'd say here are some kind of actionable tactics and strategies, and we'll have Calvin talk through them in a minute. But maybe before we jump to that, Calvin, can you give us like a little bit of a pulse check of what we're hearing across the industry, especially with like long-term care or retail pharmacies, as you're talking about these drugs being kind of underwater from a payment versus cost perspective outside of the health system? How are people starting to react to the impact the IRA is having on some of these drugs?
Yeah, I mean, what we're hearing from some of the pharmacies is they're actually looking to not provide services for those products. So, they're actually, it's the point where they would lose too much money to buy and then dispense those products. So they're actually looking to not to be able to service, which ultimately means the patient will not receive those products, or it'd be harder for the patient to receive those products. So, there is, the reality of it is that, pharmacies like it just doesn't make financial sense for them to even consider doing that. So that's some of the changes. Obviously, one of the things that pharmacies can control is their costs. And so, purchasing, being more diligent in your purchasing, more diligent in the agreements that you have with your primary vendors and the relationships that you have is one of the levers that pharmacy has had and will continue to have. There isn't really, there isn't anything that can really stop you from negotiating or getting a better price potentially. And so, they, from a payer standpoint, they can cap or kind of limit what you can get from a reimbursement point of view, but from from a costing standpoint, you have that lever, and we do see our customers using that, and it's provided big dividends for them. So they've been able to save a lot of money by doing that. One of the areas, as we talked about earlier, big opportunities on the generic spend side. There are a lot of sources for generics. And we know that the primary vendor is your primary vendor, and they have source compliance programs and rebates associated with it. We 100% support that and back that, and we'll talk about that a little bit later. That is still an incredible, important portion of that, but it's really creating awareness of like what those programs mean to you, what they mean for your bottom line and cost, and if there are other options for you for some products, like how would that fit in, and how do you manage that? And we found that on like when you look at your aggregate and your generic spend, folks that actually are buying outside the top 200, a lot of people look at, oh, we're going to focus on the top 200 product to save money. We found with our clients that they save 2/3 of their savings outside the top 200. And in order to do that, you need a tool that's actually looking at all those prices and looking at how that's going to affect your primary agreement. And in doing that, like buying those items outside top 200, they typically do not negatively impact your primary vendor agreement and your rebates associated with it. So, that's one of the things to kind of look at is like, really fully understand your contracts, and then being able to optimize that and the pricing within that, and the relationships that you have with other vendors or secondaries, or even potentially direct. Really understanding, your strategy. One of the things that we do within our product is really help you make sure that the purchasing strategies that you're working towards are actually executed and provided, from the folks that are actually doing the purchasing within your pharmacy. So it's great to have a retrospective view of like, hey, here's all the things we could save money, but then you actually have to execute and do that. So it's really important to have a system that actually helps you identify those opportunities, but then B, once it's identified, how do we actually make it actionable, and being able to do that. We kind of speak to lower cost alternatives formula. We all know there's a cost to change product, but again, having a smarter system that actually looks at cost and take that in consideration for changing product, because that's an important piece to be able to ensure that you are still compliant, and you are still driving to a lower cost, but you're not chasing pennies, you're chasing things that actually are significant. And that makes sense, whether it's automation or other things you have in your systems to take that into account of those changes. And to indirectly kind of speaks to standardization. Having a standard system for the way you do things, and from procurement to receiving to validation of product with DSCSA and so on. We'll talk about a little bit of that. That saves a ton of time, because you don't have disparate systems. You're doing one thing in one system, another thing in another system. You have one system that actually is managing all that for you. We've seen huge time savings for folks, our client base anyway, that are kind of using that to maximize that. And the last piece is really technology, adapting to technology, which I know in the acute space, for the most part, acute pharmacies have done, inpatient pharmacies have done a really great job with automation. So having ways to automate your processes save a ton of time. And then there's, like I said, the actionable piece, the connection between that and your procurement process, and ultimately receiving and putting those goods back into stock, how you actually streamline that process and automate that process. Again, very significant dividends in terms of time and effort our pharmacies have been able to see.
So maybe that's a good segue there, Calvin. Procurement in any part of healthcare is not an easy or straightforward process. But I think for those that don't live it every day, can you share for us exactly how the procurement process for pharmacy plays out, and walk through a little bit of the complexity of it? Because I think it's almost staggering at times when you realize it.
Yeah, and again, there's we see all kind of levels. There's a big spectrum here, but I would say on average, everybody has a primary vendor. Everyone has, again, it depends on the setting, whether you're long-term care or acute, you have a GPO that you're using. And then then you have secondaries. You might have even, tertiary type locations that you're buying product through. Some buy direct through manufacturer. So you have all these different systems you actually have to place orders through, or know where you have to place orders for. So, you have a product that needs to be replenished. Okay, where do I get that product? Does that go to my primary wholesaler? Does it go through a tertiary provider, secondary? And then I have to log into that system and then be able to order it. There are some systems that generate, an order based on demand. Those tend to be that I've seen very linear. They're very SKU based. And as we know in pharmacy, things are always changing. So you kind of want to look at it holistically at the product group level, because, ibuprofen, 400 milligrams, you could have, one manufacturer one day, another manufacturer another day, and you still may have some of that older manufacturer on your shelf, and you want to account for that from a inventory standpoint. And so, looking at those things, from a grouping standpoint, it provides a ton of value, and making sure that you're actually utilizing that inventory and you're not building inventory, and you're maximizing and getting inventory at the right time. And then there's, once you build that order, you have to actually process that through all these different sources. And then once you do that, you now have data, and purchasing data in all these different locations. And so I might have a cost for drug A in one bucket and another cost for drug A in another bucket or another vendor. And so kind of collating to know what your true cost of goods are, how much you bought, those types of things tend to get spread throughout different systems, and makes it challenging to manage. And then there's the process of not just the ordering part, but then when the goods are received, how are you validating those goods? How are you making sure that you're being charged for what you actually received? So validating an invoice. And then how do you validate that against your contracts? So if you do have GPO contracts, or you've negotiated a price, making sure that price is being honored on that invoice. And then obviously getting those goods back into inventory and recording that. So those tend to be separate, based on the sourcing and how those things are done, which then makes each process a little unique and different, or manual, in many cases manual, which takes a ton of time.
So Calvin, you mentioned this is kind of a time intensive process. I mean, give folks an example. If they're not down in the pharmacy, how much time could a pharmacist spend per day, or a pharmacy tech spend per day doing this sort of activity?
Yeah, I mean, a lot depends on the size of the pharmacy. I mean, we have pharmacies that literally, they have purchase spending the whole day. I mean, that's, their job. And, in some cases you have multiple people spending a day, their days doing purchasing. I would say like a typical type of pharmacy, they could spend 3 hours a day. And one of the things, and it's not an infomercial at all, but just, in terms of like what a system can do from a time saving standpoint, from customers doing the way that they've done it in the past to using a system like SureCost, we've seen them actually, reduce their time by 2/3. So, what might have taken 3 hours now takes an hour, or even less than an hour. And then you actually implement like perpetual inventory, like an inventory management solution, you actually even save more time. And because, now really you're just focused on making sure the inventory is right. The system's actually doing all the lifting in terms of what the need is for replenishment. And it's managing the complexity around all the different sources you have, the availability of what's in stock at these vendors, and then you have a standard way of receiving. And again, receiving, as we talked about, kind of that invoice compliance, that validation and contract validation, but there's also, DSCSA now coming, and being able to support that. So if you have one type of technology that you're using to do it, and it does it all at one point in time, you scan it once and all that is done, you save a ton of time there as well, because, a lot of systems, you might have to do it in one or two different systems, and do those systems talk to each other. That's one of the areas that want to ensure that those systems are all communicating as well to streamline the data flow internally within your operations.
And really quick, just because we've mentioned it a couple of times, can you define DSCSA in case folks don't know?
Yeah, it's the drug. It's the DSCSA. I always have to think about. It's the Drug Supply Chain Act. So it's basically for the purpose of DSCSA. For those that don't know, it's and I don't quote me on the year this started. I feel like it's like back in 2018-ish, somewhere around there. But the whole purpose is to really ensure that there's no diversion of product, that the product that is being made at the manufacturer ultimately gets to the patient, and there's not any kind of counterfeit product or, diversion of that product. So literally everything that is traceable, and the FDA has determined what is a traceable item versus a non-traceable item. Everything that's traceable is a actual prescription item. There are some injectables and that are excluded from that, but pretty much every bottle would be serialized, and so that serial number is unique for literally every bottle or vial that comes off the line. And so when you receive it, that has to kind of track back to the original origin document. Again, this is all electronic now. But that origin document sent to the manufacturer is then sent to the wholesaler, which then is sent to you. And we need to make sure that all ties together to ensure there's been no diversion. And if there is, something doesn't match, you have to have a policy and procedures to be able to recognize that, identify it, quarantine it, report it, return it, and pharmacies will be audited as well for that type of thing. So to make sure that they have tools in place to ensure that is being done.
Perfect. So going back to the very complex procurement system that exists, I mean, what are some strategies to make things a little better here, Calvin?
Yeah, I think this is an area that, again, I've seen this where, folks will have spreadsheets where they kind of go from one terminal to another terminal, kind of looking at prices or comparisons of items. And, you even have this even with the single vendor scenario, that there are competing products, and I kind of use that ibuprofen 400 milligram as an example, where you have something that there could be 10 different manufacturers of that product. Some might be on a GPO contract, some might be on the vendor contract. Some of those prices, even on the vendor contract, are not the best priced item. So, really kind of looking through and understanding your catalogs, understanding what those contracts are and those prices. There's also rebates associated with it. There's performance rebates associated with it. And being able to see what those are and how they reflect into your actual unit cost, which is really what matters, is challenging to do. And then you start layering that with other sources of product. It's one of those things that, again, is virtually impossible because, those prices potentially can change on a day-to-day basis. There isn't a lot of stability around it. And so to be able to go through all those things is very time consuming. So, having, again, a product that consolidates those catalogs gives you one view to look at it to help you understand what is my best price, what is the most compliant item, makes life so much easier because you're not looking at a big spreadsheet with all these things or looking at different terminals for it. You have one place to look at it. And then you can pick that item, place that order, and it's just as though you placed the order with the vendor directly. Everything's streamlined. It's all electronic. You get verification of that order, and whether it's a GPO or it's your WAC account or it's your 340B account, all that data gets sent through to the wholesaler. They acknowledge it. They send back what they're filling. And even our system, we have real-time availability, so we even show what's in stock at the DC that serves those pharmacies. So that helps streamline that operation. And then, that type of data, like your costing data, your purchasing data, even cost of goods movement, if you're moving product from one department to another, our system supports those transfers and those costs associated with it. And then having that data being sent to your ERP system, whether it's accounting or to Epic or to whatever system needs to consume that, it can do that. So it has full understanding of what actually happened. And you have a single source for that data. So you have kind of that record, the truth, record of truth would be, SureCost. Coming to a product like SureCost to be able to see that is a huge benefit for folks. So, and the other big piece of this is having that type of automation helps you standardize the process, and having standardization allows for easy adoption of it. As you bring new people in or folks that maybe not familiar with purchasing or pharmacy even in general, it has all those strategies and programs built into it. So it makes those decisions based on what you've designed it to do. and it takes the guesswork out, or that domain knowledge that might not be there, or is challenging to have somebody that has that to make those decisions on a day-to-day basis.
So then maybe talk us through, you've got a better system, you're thinking about how to deploy the right strategies. I mean, it's kind of amazing even to think about that. If you get the product purchased from the right place, how do you ensure that you got the right price, or you got the right quantity or amount that you're supposed to get?
Yeah, so again, we kind of spoke to this earlier. I think one of the things is to be able to ensure that you're actually auditing those transactions, against the invoice, to make sure that those contracted prices are being honored. We have found with our customers that 14.6% of GPO items were priced incorrectly. And so, that's significant. When you think about like the total GPO spend, almost 15% of those were priced wrong from the wholesaler. And so having that visibility and that transparency, and I know GPOs provide services that do kind of a retrospective analysis, but they're waiting on that invoice to be sent. And again, the frequency, like in a system like ours, you can actually see it as soon as that invoice comes in. We actually even provide it at the time of order. So when you're actually ordering that product, we create awareness to the user that this item is not matching the catalog. So if there's an expected GPO or contracted price of $10 and the catalog price is $12, we're going to alert the user that there's a mismatch and provide awareness of that. Ultimately, what matters is when you're invoiced, and so we adjudicate those as well, and you get real-time feedback. And what that does is that leads to the ability for the health system to be able to go back to the wholesaler to get that fixed quicker, because every day that's incorrect means that you're being charged incorrectly, so you're incurring additional costs, and it just takes longer to get it fixed. So the sooner it can be identified and corrected, the sooner you can get the right price and be compliant there. The other types of compliance is really around your contract, even with your primary vendor, and making sure that you're getting the right contract with your primary vendor, whether you're a WAC cost minus, making sure those are correct. There are other things within your primary that you want to ensure you're benefiting by, and even to that extent, when I order drug A from my vendor, if they substitute to drug B, I want to be aware of that, because a lot of times when you're ordering through their systems, drug B shows up. That's equivalent, but it's not what you thought you ordered. And is it at the price point you should have gotten for drug A? And so are you being kept whole with that? So there's benefits there on in terms of compliance. And we kind of look at compliance from our company. We kind of look at it two ways. There's what I would call internal compliance, and then there's external compliance. So internal compliance is you have a strategy, you have a program that you want your team to use. You have a preference of vendors, you have a preference of source items, your preference is so and so. You have the savings, like minimum savings to be met to change items and so on. So you've created this program and strategy. Now you want to make sure folks are actually adhering to that. You have a formulary that you want them to adhere to, and all those things within your program. And so one of the things that we've strived for is to be able to actually identify those non-compliance times. And there are, we all know that there's always one-offs, and it could be a patient need, it could be a physician need, it could be availability, the product is not in stock and you need to get another source. Having knowledge of what that is, who the user was, what did that really cost you? These things add up, and we found that they can be very significant. And so, one of the things that, our system does is tries to adhere to everybody to meet and follow the strategy and program, but also allow some flexibility if there are use cases for that not to hold up, that they need to kind of go off and order something that's not part of the strategy, that they still can do it, but there's accountability and documentation around it. And that's been highly effective at driving compliance and pull through, even if you negotiate prices and commitment on product. We've been at like 99% effective at doing that, because the system drives to that, which puts the purchasing power back in your lap. And then the other part is Good.
Oh, sorry. Can I just offer one real world story here? So again, for this idea of internal compliance, it seems like every year it's getting more complex, or there are more strategies in play. We were talking to a large IDN in the Pacific Northwest, and they were describing across, their hospitals, their retail pharmacies, their outpatient clinic pharmacies, as well as some other sites that, they had their primary GPO, they had secondary GPOs for oncology and ambulatory services. They had a prime vendor. They had multiple secondary vendors. They purchased from at least 4 manufacturers direct, and then they had just added Mark Cuban's Cost Plus. So when you start thinking about all those different strategies that they were trying to deploy to bring down cost, as mandated by the CFO, as we're all trying to bring and rein in the cost of healthcare, for any purchaser at any one of their pharmacies, because they did distributed purchasing, they're trying to balance all of those contracts, all of those programs, all of those strategies every day while they're trying to keep product on the shelf and ultimately getting to patients. So, a few years ago, maybe having a prime vendor and a GPO was enough. It seems like today, for large and sophisticated organizations, you could be running a dozen different, I'll say, macro strategies, much less the terms of those contracts, which are quite convoluted, including carve-ins, carve-outs, and other exceptions. So it really is something that far exceeds the ability to have a spreadsheet or kind of notes on the side and make the right choices real time.
Yeah, 100%. And then there's also, we could spend, and actually I'm looking at the time here, there's a lot to cover, but we could spend a ton of time just like, the centralization warehouse, we know some of the larger IDNs, some of the larger systems having their own warehouse, which, makes a ton of sense, but, getting compliance in that, really understanding movement of product, replenishment of the warehouse, all those things. We have customers that do the same thing, and, maximizing that value is significant, pays significant dividends in terms of cost benefits to the organization. So again, there are many layers, and having a system that actually helps, like I said, make it actionable is really important. And we'll talk here in terms of like the next piece is like staff burnout. I'll let you speak to it a little bit, but this all ties to this indirectly a little bit, that, hey, I'm frustrated, I got to do all these things and I don't have time, and it's repetitive, it's over and over again, and it leads to fatigue. So having systems that actually automate these things or making life more predictable helps to focus on more meaningful care, to automate to the patients, and higher employee satisfaction, which, I'll let you speak to some of this.
Sure. No, we can pick up the pace here a little bit, but I think for those on the line, we hear a lot about physician burnout and turnover, nursing burnout and turnover. Some of you may be surprised to hear that the problem is just as acute within the pharmacy. And this is true for both pharmacists and pharmacy techs. So the fact is, we were at a chief pharmacy officer conference last year, and I think every talk brought up 2 things. One was 340B, and the second was staff turnover and burnout, and the fact that nobody can keep staff or keep fully staffed, and when they had to replace, how hard it was. So I think to your point a second ago, Calvin, anything we can do to eliminate the administrative or burdensome work and get these folks onto the stuff that they really love to do, the stuff they went to school hoping to do, which is really, the part of pharmacy and interacting with patients and driving better outcomes, far more enjoyable and joy giving than flipping between multiple websites trying to find a replacement cost for insulin or whatever.
Yeah, absolutely. And, I think, we talked about some of these, on the next slide is, and I won't spend time really going through each of them individually, but, we talked about kind of simplifying your workflow, automating processes, centralization, those are all things that actually are going to provide more time for folks. And you kind of take the guesswork out, and B, you simplify the process so it's repeatable and it's easy to do. And, that gives more time back for folks, which is great.
Yeah, and one stat that was on the last slide, or concept that was on the last slide, just for people to know, pharmacy school admissions are well down. In fact, most pharmacy schools can't even fill their incoming classes right now. So the hope that we can just train that next generation to replace those that are retiring or leaving the workforce is really not going to be a winning strategy. So we've got to come up with something else to kind of make things better.
Yep, absolutely. So the other topic we want to cover, and I know we're coming up on time here, so we'll have to keep moving quick here. I apologize. It's drug shortages that we know has been problematic. Really since COVID, it's been creeping up. And COVID, certainly kind of created a supply issue there and made it raise the bar, so to speak, in terms of number of shortages. And it remained high. Last year actually was one of the highest years we ever had. First quarter this year, it is down a little bit from last year. However, it's only the first quarter in terms of data. And one of the things that, again, no one has a crystal ball. However, with the tariffs, the tariffs were off for pharmaceuticals, but now there's a reprieve, but they will be put back on. That, a lot of raw materials come from China, pharmaceuticals come from India. It's going to change the investment strategy even for some of these companies in India to invest in US. So there is definitely going to be a squeeze on product and shortages, upcoming. And I think, whether the tariffs are as bad as they are, there's still going to be some form of it, and there's going to be some restriction. And there's certainly potentially even already a delay in supply chain just because of some of the things that have been happening. So it is one of the areas that pharmacies spend a lot of time. And this is kind of one of those areas like, time is valuable. You have a limited staff, folks are trying to get all this work done. And how do you manage that? And, one of those things is being able to have visibility across multiple vendors of what is in stock. And, even having awareness of what products are going to be potentially out of stock. And, one of the things we're working on as a company, well, one, we do provide that. So we have that within our company to be able to show those what products are in stock, and if you're looking for a product where you can get those, even if you're not with those vendors. So those are things that save a ton of time. In terms of how do you manage those shortages efficiently? Because everything I've heard in all our conversations with talking to any procurement staff and any acute care health system. Has been really around one of the areas that spend the most of their time are around shortages or items that they're ordering from non-primary vendors. And again, having a solution that actually saves that time and provides real-time availability and shows that information is critical to fulfill orders and have those products in stock for your patients and ultimately for potentially different types of surgeries or care that's being provided in the hospitals is a critical piece.
So maybe with that, we'll just take a quick second to talk a little bit about our solution or how we can help, and then we'll get to your questions. So first, maybe we'll just revisit that kind of purchasing process, and we've talked a lot about how to simplify it, unify some of the pieces directly within one platform to make things more actionable for your pharmacy purchasers or your pharmacy staff in general. And frankly, that's what our platform is built to do. It's meant to sit there, be able to understand what's available in inventory, what's needed to be replaced, where you can potentially get it from, where you can get it at the best price, process those orders, and then make it easier for your staff to receive it, ensure that you got the price you ought to and the quantity that you should. If you'd like to hear more about that, we'll have an opportunity for you to scan a QR code later. But controlling costs is going to be really hard no matter what, just because of the complexity that is involved within the system. So having everything in one place really is key. And real quickly on this slide, you don't have to take my word for it. One of our customers here, Calvin, can you speak to how PharMerica uses our platform or what they find valuable?
Sure. Yeah. I mean, PharMerica is one of the largest long-term care providers. They also do manage acute facilities as well. And they're a customer of ours and they have been for a long time. But one of the huge values is having really literally everything under one roof, which there's a quote here from them, which saves a ton of time. We kind of spoke about that earlier, both in terms of pricing, your rebates, your availability of product, the sources available to you. having all that in one application and really just being able to simply click a button to order it is a huge time savings. You don't, like I said, you don't have that case where you have to go and log into all these other different systems to get, I need to get this one product from this vendor and this product from this other vendor. It greatly improves the workflow and the time it takes to actually execute on that.
And then maybe just speaking to how material can the difference be when bringing on a platform like this. Here, one of our customers talks about how fast return on investment was realized. So systems like ours paid themselves back many times over in direct cost savings and kind of the softer costs of freeing up time and or reducing workforce turnover.
Yeah, we've seen huge ROIs for our customers. I mean, in many cases, it's double digit ROI in terms of multiple, and it depends on how complex they are, the process they currently have, all those things. But in all cases, we've seen at least a single or single mid to high single multiple of return on investment on our products. So some folks have already paid it back in the first month, the whole year subscription in the first month. Some might take a couple months to pay it back. So it provides significant dividends back to you in terms of benefit, both in the cost and just data management alone. And one of the things we kind of spoke to, because of all these pressures and really understanding of your environment. When I say environment, kind of your true cost. Having the right data is really critical for management, because you can make data-driven decisions. It's not, well, I think we do this, or I think we should buy this, or I think this was our price, or even trying to get that, you have to employ your IT teams to kind of pull this data out and normalize it. Having that's really critical. One of the other areas is around this compliance piece. When you're with your primary vendor, you have compliance protocols you have to hit in order to maximize your rebates with them, and potentially cost of goods accelerators. Chad, you mentioned like inclusion items and exclusion items that may be part or not part of the agreement. So really understanding those complexities and being able to see something real time, like how am I doing in performance to my agreements? And this could go beyond your primary vendor. You could have other agreements, other terms with your other vendors. How am I performing with that, and being able to track that, being able to track my rebates, at the vendor level, at the manufacturer level, the GPO level, is really an important piece. So you really understand where that money is coming from and how much that money should be. And we kind of spoke to the other side of it is managing those true cost of goods and really understanding what those cost of goods are with those rebates and such attached to it, so you can make better decisions. Is critical.
And then we'll just move through these last couple slides. We've spoken a little bit about the workforce burnout and how our system or others like it can help, as well as kind of how to anticipate shortages or be able to more quickly move around them so that hopefully they don't impact your clinical operations very well. So with that, again, pharmacy is a dynamic and ever-evolving industry within the U.S. It seems like every time we think things are going to slow down, there's all new wrinkles that make it even more interesting or difficult to navigate. So trying to get ahead of a lot of the trends we've talked about today will be critical to everyone's success and, of course, to us delivering high-quality patient care. I will quick pop up this QR code, but let's get to some questions. We don't want to just spend our time talking about what we want to. Steve, have we received any questions from the crowd?
Yeah, if you have questions, please put them in the chat or Q&A. And I want to thank you, Chad and Calvin, for a very comprehensive presentation. I do have a couple of questions people sent me ahead of time, and this is very pertinent. We hear a lot about artificial intelligence and how it's going to revolutionize healthcare. How do you see it in the pharmacy space?
Yeah, that's a great question. I think, in terms of, one of the areas that, again, we kind of sit in the procurement space, inventory management, procurement space. A couple of areas that we see huge benefit. One is better prediction of out of stocks items that, there is going to be, challenges with product in terms of within the supply chain. So really understanding what drug shortages are coming, what alternatives I have to those drug shortages. Is it within the same equivalent? Is it within the same therapeutic class? Are there other comparable therapeutic classes? Is it a geographic issue? Is it, a vendor issue? Those types of things. So really using AI to look at that data to be able to really understand the patterns within it, the demands associated with it, and what is available, what's in the marketplace is going to be significant. And one of the great things, for our company is we have all those data elements, and that's we're excited to. We are actively working on that project right now. Super excited about that. The other areas is around procurement. As we all know, everyone has kind of strategies and things they want to do and employ, and that's based on the agreements you have and maybe secondaries and things. But that's we tend to kind of look at it at a individual line item basis and not necessarily holistic. So again, using AI to kind of look at the bigger picture and all the little pieces that make up that big picture to understand like where I should actually tweak my strategy to really maximize it. And that's an area we're moving into as well, is to ensure, provide feedback to, hey, using this strategy, here's the benefits, here's some of the things you could actually do to even modify it to make it better. We see some real value there. And certainly on the inventory and replenishment side, we have a lot of great things we do today in terms of, replenishment. We've done, we've taken, again, with some of these larger pharmacies, we've taken it like where they might have had 115 or 140 out of stocks down to 10, just because of better inventory management. And in doing that, they did not increase their inventory. They actually decreased inventory. So they're more efficient at managing. So using, again, AI to kind of look at, based on, the utilization around flu season or, around certain seasonal times of the year, are there things that I would need to buy more of, and having better predictability around that? We see huge benefit there as well.
It's interesting you're talking about procurement and inventory. Another question I received, and you covered this a little in your presentation, but I think it's worth repeating. What do you feel, based on your experience, are some of the most effective ways to streamline procurement, but at the same time balance that so you ensure compliance?
Mm-hmm. Yeah, I think, again, this is something, when I founded SureCost, I've been in pharmacy. I had my own pharmacy operations. I managed and owned them. And I was head of procurement for a large long-term care pharmacy provider for a few years. And then I said, there's got to be a better way of doing this. So, kind of created SureCost to do that. And the concept is really to and I did speak to this, is really unify all the relationships you have and all the pieces of those relationships, what those agreements entail or don't entail, what those, how those rebates are structured, whether the market share or flat. So you have a real picture of those programs that you have. So when you're actually doing the purchasing, the system is actually determining what is your best, source, what is your best product. And then, again, visibility to what's in stock, can I actually achieve that? Can I get that product? And if not, because we also know that, a lot of folks have failure to supply agreements with their primary vendor. So being able to account for that and be able to show the vendor that, hey, this was not in stock, I had to get it from another source, like all those record keeping pieces, and even record keeping on the invoice validation, authorization, three-way invoice matching, is time consuming. And having a system that simplifies that process but still ensures accountability is something that is needed, and we've seen saves a ton of time and has provided a huge cost benefit to our pharmacies.
You covered this also in your presentation, and you gave some great examples. But as you look at the trends that you see with the health systems you deal with, what are some of the strategies beyond GPO, primary wholesaling contracts, that you recommend we really focus on, especially with impending tariffs, to reduce the overall drug spend?
Yeah, that's a great question. I've seen too, some of these things depend on size, right? So, if you're large enough, I and have seen, centralization, taking ownership of kind of core product through either a third-party logistics company, that's kind of managing a warehouse, where you managing a warehouse for product, does make sense. Again, you can't be all things, so you're not going to manage everything, but you might want to manage the top 200, 300, 400 product SKUs that you have, and there's benefit there. So we've seen some real significant benefit for those. Again, it depends on the size to make that happen, and going direct to the manufacturer, you're going to save money by doing that. That's one. Inventory management we've seen, again, kind of my early example of, drugs now can cost, $10,000, $15,000, $20,000. So having awareness of your inventory and knowing what, where your inventory is, what it's costing you, is it turning, is it not turning, moving that inventory quicker in terms of being able to return it, to the wholesaler, because if you do it within a certain period of time, you get full credit for it. Working with a reverse logistics company, those things, again, is something that has to be managed, and having a system and having visibility around your inventory holistically makes a difference. And even within that, being able to recognize inventory, again, this depends on size, but if you have many locations, being able to recognize excess inventory at another location that could potentially be consumed by one of the other locations you own, that's going to save a ton of costs too, because now you're not repurchasing that, you're actually moving that inventory to a more effective place. So inventory optimization, those would be the two big things I could see. Certainly adding vendors, and Chad spoke to this a little bit earlier, and I had experience. I was on the board of a small rural hospital for 11 years. This is over a decade ago, but the mindset was, hey, I have my wholesaler on my GPO, I'm good. That doesn't work anymore, both because of they don't have all product, so you need to be able to source product from other sources, and two, pricing is not always great. So again, you want to maximize your agreement. You need your primary vendor. I'm not trying to dilute that in any way, but there is still benefit of having other sources for product. And again, as long as you have a system that manages that effectively for it, you can do that.
Calvin, I'll build a.
Go
Steve,
ahead.
can I build on that for 1 second? I think your example is great, but I would tell everyone here, challenge the status quo. We were on with a pretty decent sized IDN in the Mid-Atlantic just a couple weeks ago, and frankly, they were relying on their prime vendor and their GPO, and that was it. And I was kind of floored that an organization that large and sophisticated would have that few strategies in play to reduce drug cost, especially given recent trends. So for everyone on this phone, Calvin's rural 10-year ago story may have been true. There are still pockets of this out there, and I would encourage you all to make sure that you're not one of them, because you could be leaving millions of dollars on the table.
That's a good point. And y'all, Calvin, you did a great job of talking about inventory and inventory management. But let's go upstream a little bit. We've got the rising drug cost. How do you think, and based on y'all's experience, we can better control the purchasing decisions up front, and at the same time not create bottlenecks for our pharmacy teams?
Yeah, again, I think it depends on the tool you're using. I hate to be like an infomercial thing as far as like SureCost thing, but I think provided you have a tool, and it doesn't have to be SureCost, but a tool that actually provides you that visibility of what products and pricing and sources you have available to you, that you can actually then effectively, again, this is where strategy and kind of what I would say filters, like kind of the ability to kind of control the view that you want your purchasers to be able to see, should be focused on the top things that meet the strategy, right? You don't want to give them a whole list of, hey, here's all these items, go find the best item. You want to be able to say, okay, I know you're looking for, and I'll use my ibuprofen 400, looking for ibuprofen 400. Here are the top 3 things you should be buying. And then, directing them to that they can now click a button and be able to execute a purchase order and be able to, or add it to a purchase order to be able to submit it electronically and verify it. It's all good. That that is one of the things that, and again, we've seen this with our customers, they save a ton of time, and it's an effective way to reduce your costs, because now you have visibility, and it's not, not noise, because you see a bunch of things. You're going to be like, oh my gosh, which one do I pick? You're really seeing what you need to see to be effective. And you still, if you have to go and see more because of, like I said, these one-off scenarios, you still have that ability, but that's also being tracked in it, and there's accountability around that. So those would be things I would say, again, whether it's SureCost or some other platform, you want to have a platform that actually helps you execute. And it's not just a retrospective. I know there's some systems out there that say, hey, here are all the things you should have done. That's great, but now you have to execute on that. And so you do want to look at a system that actually does both for you, because that's, in the end, you have to execute, because you won't realize savings unless you do.
Calvin and Chad, I want to thank you. Believe it or not, we've been having such a good discussion, but we're at the top of the hour. What an excellent webinar, and we can't thank you enough. And as we close, I'll ask both of you, do you have any closing thoughts or final words before we conclude?
No, I thank everybody for joining today. I thank you, Steve, and for giving us the opportunity here. Like Chad has mentioned, there's challenging times for pharmacies. There's also, when you have challenge, there's opportunities. So this kind of creates, and this is kind of, I think, what Chad mentioned earlier, is kind of push kind of the norm, a little bit, to kind of say, hey, we need to make changes, and with change comes progress and opportunity. So we do encourage folks to kind of do that and look at the paradigm maybe differently than they might have in the past, and I think good results will come from that.
Okay, well, we want to thank you. Excellent webinar, and this does conclude our webinar. I know Chris has recorded this, and to the people that have registered, I think by tomorrow he'll send out a recorded version. So thanks, everyone, and have a good afternoon.
You too. Thanks, everybody. Thanks, Steve. Thanks, Chad.